Thank you for having me here today. My name is Dr. Raymond Perry, and I'm a physician and the director of Hubert Humphrey Comprehensive Health Center, which is in South Los Angeles. Our health center serves nearly 45,000 patients of all ages, most of whom are Black or Latino, and we provide primary, specialty, and urgent care services. We're part of the larger Los Angeles County Department of Health Services network that Dr. Kim spoke about that serves patients and people across the county, over 500,000. But today I want to take this opportunity to talk about the importance of vaccination and our efforts to fight COVID-19 on the ground in our clinics. I'll speak both from my professional and personal perspective as a Black doctor who is serving in one of the hardest hit communities in Los Angeles. I want to first start by echoing some of what Dr. Kim said and just say how great it's been to see the excitement among our patients who have started to get the vaccine over the last couple of weeks. Nearly all the patients here at Humphrey who have gotten the vaccine so far have been people who are over 65, and they've been mostly Black or Latino because that is the community that we're serving. It's been incredibly heartwarming and encouraging to see so many people who feel that they finally have an opportunity to do something to protect themselves and to help their community to fight COVID-19. I've seen people cry tears of joy. I've seen them hug the nurses who are giving the vaccine. They take selfies as they're getting the shot. I even saw an older gentleman do a little dance in the waiting room after he'd gotten the shot. And I spoke to an older couple that was Spanish speaking. They'd been married for 50 years, and they came to get the shot together because they said they wanted to live together for another 50 years. So when I speak to people, almost everyone who's getting the shot said they're grateful for this chance to be among the first in the community to get the vaccine. And they just really hope that other people will follow. Because the patients we've been vaccinating are generally older, some of them have also spoke to me about why they feel like they have a duty to do this for their family, to protect everybody around them. And they hope that they're showing their kids and their grandkids that we all need to get this shot for our communities to stay healthy. But as we've talked about today, I've also heard from many patients who are hesitant to get the vaccine. And I've seen a lack of understanding about the vaccine and who should get it. So I'll spend some time addressing those concerns today as well. As me, Dr. Kim, and Dr. Gonzalez here today have talked about, we're all committed to engaging and supporting our communities and our patients. We want to make sure that they have factual information so everybody can make an informed and healthy decision. In this case, we want to guide them to feel comfortable getting this vaccine because we know that it's safe and effective, and it can really help our communities. So first, we'll talk about hesitancy, and I'll specifically talk about hesitancy in the ethnic communities, and particularly the Black and Brown communities that I see and I serve in at my Humphrey clinic. I think everyone knows by now that the Black and Latino communities in particular, nationally as well as here in Los Angeles, have been disproportionately impacted by COVID-19. There have been more cases of COVID and more deaths from COVID in these communities. Yet these are also the communities that may have more hesitance about the vaccine. So the people that need and could benefit the most from this are the same ones who we need to engage the most to make sure that we can increase the number of people in these communities that get vaccinated. I know that many residents in our communities of color are more likely to potentially have some distrust with some aspects of our healthcare system. There is definitely a long history that can't be forgotten that includes racism and injustices against us when it comes to medical treatments and access to care. And as a Black person, I understand where this is coming from. But as a physician, I know that our health system has come a long way. And particularly here in Los Angeles, I know that our county health system is genuinely focused on equity, especially for communities that suffer from poor health outcomes, largely because of societal injustices and other social determinants of health. It has been really nice to see that many of our patients and our community members recognize the work that we're doing with them and for them to protect and improve the health of everyone that we're serving. This vaccine is not an experiment. We know that it's safe, and we want everyone in Los Angeles to get it so that they can protect themselves and those around them from COVID-19. We know that COVID is continuing to kill people in our communities every day, just like the data that Dr. Gonzalez showed us earlier. This vaccine can help, and I think that a lot of our community knows it. We want to spread that word. The vaccine is getting distributed widely. we're actually putting extra effort to make sure that it's getting to communities that have seen the worst impacts of COVID-19. At my health center in South Los Angeles, as well as our partner clinics and hospitals in the Department of Health Services, as Dr. Kim mentioned, we're calling thousands of our patients, sending texts, sending emails to let them know that they're eligible for the vaccine, and we're scheduling them for vaccine visits every day. But I think there are reasons that are still driving a lot of hesitancy about this vaccine, and one of the main reasons is just some concern and mistrust about the vaccine itself, how fast it was created, approved, and produced. I understand this concern. I don't only hear it from patients, but I also hear it from family and friends that are close to me. So I'll tell you how I respond to them and how I try to give them the truthful information, not just my opinion about the vaccine, so that they can make the right choice for themselves. The reality is that this vaccine went through the same approval steps as any other vaccine, but it was approved faster for a few reasons. So the first reason is that because of the devastating impact that COVID had on all communities and all economies and all sectors of the industry last year, there was a lot of investment and a lot of need to make this vaccine happen quickly. So there was a lot of money that was put into making the vaccine. More money came from the government and from the private sectors for the COVID vaccine development than we usually see for other medical research. With this money being more than we usually get, or coming more quickly than we usually would get it for medical research and development, we could get more done in a relatively short period of time. Second, because the disease is so widespread and the need for a vaccine was really relevant to everybody in all communities, it was easier to find tens of thousands of volunteers from all diverse communities around the country to enroll in the studies that were necessary to make sure that the vaccine was effective and safe. Normally, research takes longer because we have to find volunteers that want to participate, and the disease is less common, so sometimes it's actually harder and it takes longer to prove that the vaccine is actually effective in preventing infections and preventing spread. With COVID, we were able to get the number of people and see the impact of the vaccine more quickly so it could get approved faster. Third, even though the COVID vaccine is relatively new, the technology and the science that helped to create this vaccine is not new. It's been studied for decades, so it was ready to apply quickly towards the development of the vaccine for COVID-19. So there are two vaccines that we've talked about that are being given right now from the companies Pfizer and Moderna, and they've both been through the standard required trials and the rigorous approval process. I understand that how quickly it happened can cause some concern and some doubt among people. And so I think it's really important that we just reassure people, particularly those in communities of color, to understand that this vaccine was developed safely and that it's proven to be effective, and that we're just fortunate to have this vaccine to try to combat the pandemic now. In these trials, and even since the vaccine has been given to millions of Americans over the last 2 months, we've continued to show that the vaccine is safe. So this is why I was eager and grateful to get the vaccine when I did. As a healthcare worker, I was able to get my first dose in December and my second dose in January, and I feel great. I feel protected. I know that I still need to wear a mask and wash my hands and follow social distancing guidelines, but I feel like I'm doing my part to protect myself, but also to protect my family, my friends, my coworkers, and my patients. The way I see it is I'm one less person who might have gotten infected with COVID-19 and could have passed it along to others. And I know that by taking the vaccine that I'm able to protect myself and that I can continue to work as a physician and to help to protect the community. Having seen the devastation that COVID has had here in Los Angeles, and even having been personally affected by family and friends that have been sick from COVID or even died from COVID, it was really important for me to get this vaccine as soon as it was available. And now I feel like it's important for me and other healthcare workers to continue to encourage other people to get the vaccine as soon as it's available to them. I've been really proud to see my coworkers in healthcare to get the vaccine, especially those who are Black, Latino, Asian, and everyone who serves in communities that have been most affected by COVID. I feel that it's our job to protect our community, not just by getting vaccinated, but by educating and by demonstrating to our patients that we trust this vaccine, that we know it's safe, and that it's and that it's effective. I have heard other patients say that they don't feel that they need to get the vaccine because they already had the infection and they've recovered. However, we do recommend that everyone gets the vaccine, even if you've already been infected with COVID. We're still learning about this virus, but we have already seen that the natural immunity that comes from this infection may only last a short period of time. So getting the vaccine is the only sure way to make sure that your body has strong immunity against the virus right now. The vaccine basically teaches your immune system what the COVID virus looks like, so your body can fight the virus if you're exposed to it. If for any reason, even after getting the vaccine, you still do get infected, the vaccine will help to keep the infection from becoming severe. As Dr. Gonzalez said, the vaccine does not give you the virus. While other vaccines that we use in medicine have depended on using a small weakened or dead piece of the actual virus or bacteria in order to build up our immune system, the COVID-19 vaccine is different and does not use the virus at all. And it's been proven to work very well. It's been effective, and this is why we're confident in offering and encouraging all of our patients, all of our community members to get the vaccine. So what I really want people to know is that getting vaccinated is safe. It will prevent you from getting sick from COVID-19, and it'll help us stop the pandemic in our communities. Even if you've had COVID-19 infection, you still need to get the vaccine and make sure that you receive both doses. This vaccine is the only way to know that you're protected right now. As I said, the vaccine will not give you COVID-19. It'll just teach your body how to fight it if you get exposed. After you get the vaccine, it might still be possible for you to get infected, even if you don't feel sick. And you could spread the infection to others who might not be vaccinated. So again, that's why it's important that everyone gets the vaccine. And it's important that everyone continues to wear a mask, wash your hands, maintain social distance, and limit the number of people who you're around. If you're a healthcare worker, if you're over 65, you can get the vaccine now, so do it. It's critically important that everyone gets the vaccine to protect our community, especially in communities of color. And so I just want to make sure that everyone takes home the message that this vaccine works and that we need as many people as possible to get it, to keep themselves healthy, to keep those around them healthy, and to prevent the spread of the pandemic.